in the global socio-economic space. We'll begin with the story that the UK drug maker GlaxoSmithKline plc will expand production of vaccine efficacy boosters to produce 1 billion doses in 2021 for use in shots for COVID-19, the company has said. The company added it was in talks with governments on backing the program, which would allow the expansion of the scale of production of future successful vaccines for the COVID-19 disease. Turkey began operating intercity trains today after a 2-month gap as it gradually eases coronavirus curbs in a bid to restore normal life and reopen an economy facing the threat of recession. At 4 o'clock GMT, an intercity train left the capital Ankara for Istanbul for the first time since the March 28 halt in services. Trains will make 10 trips daily, although individuals aged 20 or less and 65 or older cannot travel. To fight the virus, Turkey had imposed weekend stay-at-home orders, halted most travels between large cities, shut restaurants and schools, and mostly sealed its borders. But the government has begun rolling back some measures as the spread of the virus slows, saying it aims to normalize life until August. Employers should pay the wages of anyone told to stay at home by England's COVID-19 test and trace system, British Health Minister Matt Hancock has said. The service is aimed at allowing the loosening of lockdown measures for most of the population. From today, contacts of those who test positive will be instructed to isolate for 14 days, even if they have no symptoms. Asked during an interview on Sky News if employers were being asked to step in and pay people's wages while they isolate, Hancock said yes. If you are instructed by the NHS for public health reasons to stay at home, then that is the equivalent in employment law to being ill, and it's very important that employers are flexible about this, he said. South Korea has reimposed a series of coronavirus social distancing measures as a series of clusters threatens to challenge its success in containing the epidemic. Museums, parks, and art galleries in the Seoul metropolitan area will all be closed again for 2 weeks from tomorrow, said Health Minister Park Nyu-ho, while companies were urged to readopt flexible working practices amongst other measures. We have decided to strengthen all quarantine measures in the metropolitan area for 2 weeks from tomorrow to June 14th, he said. Millions of women worldwide are facing shortages of sanitary products, price hikes, and worsening stigma while managing periods during the coronavirus pandemic, a charity has warned. About 3/4 of health professionals in 30 countries surveyed by Plan International from Kenya to Australia reported supply shortages, while 58% complained of rising and prohibitive prices of sanitary products. Around half the respondents cited reduced access to clean water to help manage periods, and a quarter worried about greater stigma for discriminative cultural practices linked to menstruation for women who were trapped at home by lockdowns. Finland has seen no evidence of the coronavirus spreading faster since schools started to reopen in the middle of May, the top health official has said. The time has been short, but so far we have seen no evidence, Mika Salminen, Director of Health Security at the Finnish Institute of Health and Welfare, told a news conference. Finland started to reopen schools and daycare centers from May 14th following an almost 2-month shutdown. International tourism is set to fall by 70% this year, marking the sector's biggest slump since records began in the 1950s, United Nations World Tourism Organization Secretary General Zurab Polikashvili has said. He said this prediction for the coronavirus hit sector was based on the assumption that countries around the world would gradually open their borders from August. A partial reopening of Danish schools has not led to an increase in coronavirus infections among young students, a doctor of infectious disease epidemiology and prevention at the Danish Serum Institute has said, citing new data. Denmark was one of the first countries to reopen society on April 15th after a 1-month lockdown, allowing students up to 5th grade back in school. You cannot see any negative effects from the reopening of schools, Peter Anderson told Reuters, referring to data updated yesterday. The latest data showed no significant increase in infections among children aged between 1 and 19 in the weeks after the partial reopening of schools. European governments should not cut healthcare spending during the current economic crisis sparked by the pandemic and associated lockdowns, the World Health Organization has warned. We are concerned that countries will respond to this crisis in the same way they did to the recession 10 years ago by cutting public spending on health, WHO Regional Director for Europe, Hans Klug, told a press conference. Those cuts prevented many people from accessing the health care that they needed. Cases of community transmission of the coronavirus are growing in Africa, particularly in Ethiopia, and a new strategy for testing is needed to prevent this. The head of the Africa Centers for Disease Control and Prevention has said, community transmission refers to cases where patients had no travel history or known contacts with infected people, worrying for health workers because it means the virus is moving undetected through the population. We are beginning to see sustained community transmission within Ethiopia and many other countries across Africa. That means we need to increase our public health measures like distancing, wearing of masks and washing of hands, John Nkengansong said. As part of efforts geared towards the revitalization of primary health care, the Lagos State government has carried out a comprehensive assessment of no fewer than 329 primary health care centers in the state. The Honorable Commissioner for Health, Professor Akin Abayomi, who disclosed this today at the ministerial press briefing to commemorate Governor Sanwo-Olu's first year in office, noted that the assessment focused on the level of functionality and geographical positioning system of the PHCs to identify gaps for service improvement efforts. Abayomi explained that the comprehensive assessment was carried out in collaboration with two non-governmental organizations, namely Health Assist and Farm Access Foundation, to improve the quality of service delivery at primary healthcare centers across the state. The commissioner noted that with the assessment, the key areas of focus of PHC revitalization will include infrastructural upgrade, data management, operational costs, power supply, water supply, drug supply, sewage management, staffing, immunization programs, bridging the communication gap between the Ministry of Health, local governments, and Primary Healthcare Board, facility management and monitoring, financing mechanism, and insurance scheme, amongst others. He maintained that these issues have constituted a challenge which must be addressed in the third tier of healthcare delivery. Equipped with the knowledge of identifying gaps, the administration of Governor Babajide Sanwo-Olu in the last 1 year embarked on the construction and renovation of 39 primary healthcare centers across all 57 local governments and local council development areas to bridge the gaps. 23 of these PHCs are completed and ready for commissioning, while others are at various stages of completion, he said. Abayomi averred that the Sanwo-Olu-led administration has constructed and delivered 5 medical portal cabins to 5 PHCs as part of its infrastructural upgrade drive for improved service delivery, noting that this was done in collaboration with Rotary International. Recognizing the prime place of PHC in the overall healthcare delivery system, the Commissioner advocated more synergy between the State Ministry of Health, the local government authorities, and National Primary Healthcare Development Agency to have a robust and viable service delivery of the PHC level, stressing that it would only amount to an exercise in futility if all stakeholders work at variance. The current confirmed COVID-19 cases in Nigeria are 8,733, with 2,501 recoveries and 254 deaths. Lagos leads with 4,012 cases, followed by Kano 936 and FCT Abuja 519. Abia 10, Benue 7 and Kogi 2 are the states with the lowest cases. Total sample tests carried out by NCDC at the moment are 49,966. And that brings us to the end of today's edition of The Human Angle. You can send your videos and pictures to news@poshareng.com or programs@poshareng.com and let's share your experience and views. Visit our website www.poshareng.com to get more updates from our news stories and videos. Also follow our social media platforms showing on the screen for further updates on our market reports. Join us by 6 p.m. for our evening segments, which will be streamed live on our YouTube, Facebook, and Twitter channels. See you tomorrow. Thank you for watching and do stay safe.